The first thing I noticed was the color of his fingers, deep violet, almost black, like they'd been dipped in ink and left to dry under a cruel sun. By morning, it had spread to his chest, a creeping shadow that no one in our underfunded Montana hospital could explain. I'm Dr. Meredith Lynn, a 42-year-old internist at Bitterroot Community Hospital, and this is the story of the patient who broke me, rebuilt me, and left me questioning everything I thought I knew about medicine. It was October, the kind of cold that seeps into your bones, and the ER was deceptively quiet that night. Quiet always feels like a warning in a hospital like ours, understaffed, underfunded, and miles from any major city. At 2:17 a.m., the paramedics wheeled in Jonathan Reeves, 56, found unconscious by hikers in the Bitterroot Valley. No ID, no insurance, just a gaunt man with a low-grade fever and skin that looked wrong. His fingertips were dusky, a deep plum that seemed to pulse under the fluorescent lights. I checked his vitals myself. Pulse ox 99%, blood pressure 120/80ths, heart rate 82. Stable. No signs of burns, frostbite, or trauma. Just that color, unnatural and spreading. Vascular compromise. Nurse Javier asked, his dark eyes narrowing as he scanned the chart. Javier was my rock in the ER. Observant, intuitive, never one to jump to conclusions. He'd seen his share of weird cases in his 15 years here, but this was different. Maybe, I said, but I wasn't convinced. Raynaud's phenomenon could cause discoloration. But it's patchy, triggered by cold, and doesn't spread symmetrically. This was methodical, almost deliberate, climbing his fingers to his knuckles in a perfect gradient. I pressed my gloved fingers against his wrist, feeling a steady pulse but skin that was unnaturally cool, like marble left in the shade. Let's get a full panel. CBC, CMP, ESR, CRP. Cogs, too. Javier nodded, already moving to draw blood. I watched him work, my mind racing. I'd seen hyperpigmentation before, drug-induced cases from minocycline or antimalarials, sometimes Addison's disease, but nothing like this. Reeves' chart was a blank slate. No known allergies, no medications, no medical history. He was an off-grid homesteader. According to the hikers, living alone in a cabin with no phone, no family, no ties. A ghost in the system. By dawn, the discoloration had spread to his forearms. I stood over his bed, watching the shadow creep upward, a deep violet that seemed to swallow the light. The staff started whispering in the halls. He's rotting from the outside, one tech muttered, crossing herself as she passed. I wanted to snap at her, tell her to focus. But the words caught in my throat. My mind flickered to a case from 10 years ago. A young woman with lupus I'd misdiagnosed. Her symptoms had been subtle, too, until they weren't. She died on my watch, her family's grief etched into my memory like a scar. I swore I'd never let that happen again. I ordered a skin biopsy and an MRI, hoping for answers. Reeves woke briefly around 7 a.m., his eyes glassy, his voice harassed. "It's starting," he mumbled, staring at his hands. I knew it would. Then he slipped back into silence, leaving me with a chill that had nothing to do with the Montana cold. Starting. What was starting? I didn't know yet, but the dread was coiling in my gut, tight and unyielding. Underscore 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 underscore. The biopsy results came back that afternoon, and they only deepened the mystery. No necrosis, no infection, no inflammatory markers. Just pigment. Melanin, deep in the dermis, as if his body had decided to overproduce it overnight. I stared at the report, my coffee going cold in my hand. Melanin is what gives skin its color, regulated by enzymes like tyrosinase in a process called melanogenesis. But this wasn't normal melanogenesis. This was a flood, a takeover, and I had no idea why. I called in Dr. Kim, an infectious disease specialist from Seattle, but she wouldn't arrive until tomorrow. In the meantime, I dug into Reeves' case alone, poring over textbooks in the hospital's cramped library. Could it be an autoimmune process? Something rare, like PABA syndrome or a lupus-like reaction? But the labs didn't support it. No elevated ANA, no rheumatoid factor, no signs of systemic inflammation. I considered vascular causes, thrombosis, embolism, but his COGs were normal, and Doppler scans showed clear blood flow. Every test was a dead end. By day 2, the blackening had reached his torso. His fever spiked to 101.3 degrees Fahrenheit, and he started vomiting, a thin, bile-streaked mess that Javier cleaned up without complaint. I stood at the foot of the bed, watching the discoloration spread across his ribs, a glossy obsidian that made his skin look like polished stone. It wasn't just the color, it was the texture, slightly waxy, almost alien. I'd never seen anything like it, and the not knowing was eating me alive. Javier caught me in the hall later, his voice low. You see his eyes. They're starting to yellow. And he's talking about the formula in his sleep. I hadn't noticed, and that scared me. I was supposed to be the diagnostician, the one who saw the patterns, but I was missing pieces. What kind of formula? I asked, but Javier just shook his head. Sounds like chemistry, or nonsense. I went back to Reeves' room, pulling up a chair. His breathing was shallow, his hands twitching under the thin hospital blanket. Jonathan, I said, keeping my voice steady, can you tell me about the formula? His eyes fluttered open, unfocused. They didn't listen, he whispered. I told them it wasn't ready. Then he drifted off again, leaving me with more questions than answers. Underscore 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 underscore. The hospital administrator, Carol, cornered me that evening, her arms crossed and her lips a tight line. No insurance, no diagnosis, no bed, she said, tapping her clipboard. We can't keep him here indefinitely, Meredith. I felt the anger flare in my chest, sharp and hot. He's dying, Carol. You want me to dump him on the street? She sighed, backing off. But I knew she'd be back. Rural hospitals like ours run on fumes, and Reeves was a liability we couldn't afford. I ignored her and focused on the case. I ordered a toxicology screen, grasping at straws. Maybe it was an exotic poison, heavy metals, plant toxins, something from his off-grid lifestyle. But deep down, I knew it wasn't that simple. This wasn't a poisoning. It was a process, something internal, relentless. I thought of my old patient again, the lupus case. I'd missed the signs then, subtle rashes, vague complaints, until it was too late. Her face haunted me as I stared at Reeves, his blackened arms stark against the white sheets. That night, I stayed late, combing through his chart again. The staff had started avoiding his room, their whispers growing darker. It's unnatural, one nurse said, her voice trembling, like his body's turning against him. I wanted to dismiss it as superstition, but I couldn't shake the feeling they were right. Something was wrong with Jonathan Reeves, something no textbook could explain. I was missing something, and it was going to cost us. The shadow was spreading, and I was running out of time. Jonathan Reeves' skin, once just dusky at the fingertips, now gleamed like obsidian across his arms and chest, a relentless tide of pigment that seemed to mock every test I ran. I'm Dr. Meredith Lynn, and by day 4 of his admission to Bitterroot Community Hospital, I was starting to feel like the answers were slipping through my fingers. just like they did 10 years ago with the patient I failed. Reeves was deteriorating fast. His fever hovered at 101.8 degrees Fahrenheit, his vomit now streaked with blood, and his pain had become a constant, gnawing thing he described as burning from the inside. I upped his morphine, but it barely dulled the edge. Worse, he was hallucinating, muttering about the light and the change in a voice that sent shivers down my spine. His eyes, once a pale blue, were tinged yellow. The sclera cloudy like a storm was brewing inside him. I stood over his bed, watching the blackening creep toward his collarbone, and felt the dread tighten in my chest. This wasn't just a medical mystery anymore. It was a descent. Nurse Javier caught me in the hallway, his face drawn. "He's talking about a formula again," he said, handing me a fresh chart. Said something about not enough time before he passed out. I nodded, but my mind was elsewhere, replaying Reeves' cryptic words from day one. "It's happening again," I told them. No one listened. Again. Who was them? I hadn't slept in 36 hours, and the exhaustion was carving holes in my focus. I was missing something, and it was going to kill them. Dr. Kim, the infectious disease specialist from Seattle, arrived that afternoon, her sharp eyes scanning the chart like a hawk. She was all business, her glasses perched low, her voice clipped. "No MRSA, no necrotizing fasciitis, no anthrax," she said, ticking off possibilities with a pen. "This isn't infectious, Meredith." I felt a flicker of relief, but it was short-lived. If it wasn't an infection, what was it? Kim's confidence only made my uncertainty sharper, like a blade against my ribs. "Then give me something," I snapped, my voice harsher than I meant. I rubbed my temples, the headache pulsing behind my eyes. "His skin's turning black. He's in agony, and every lab comes back normal. What am I missing?" Kim didn't flinch. She suggested methemoglobinemia, a condition where hemoglobin can't carry oxygen properly, causing cyanotic skin. It fit the discoloration, but I shook my head. "His pulse ox is 99%. Oxygen levels are fine." Another dead end. I ordered a toxicology screen, grasping at straws. Maybe it was an exotic poison. Arsenic, mercury, something from his off-grid cabin in the Bitterroot Valley. He was a former biochemist, after all, living alone with God knows what in his makeshift lab. But the tox screen came back clean, just like everything else. I wanted to scream, to throw the chart across the room. But I just stood there, staring at the numbers that refused to tell me anything. The hospital administrator, Carol, called me that evening, her voice dripping with impatience. "Meredith, we can't keep him here without a diagnosis. No insurance, no funding. You know the drill." I gripped the phone so hard my knuckles whitened. "He's dying, Carol. You want me to dump a dying man on the street because we're short on beds." She sighed, muttering something about budgets, but I hung up before she could finish. I didn't have time for her bureaucracy. Reeves didn't have time. Underscore 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 underscore. That night, I sat by his bed, the hospital quiet except for the beep of his monitor. His skin was a map of shadows now, the blackening spreading to his thighs, glossy and unnatural. His breathing was ragged, his hands twitching under the blanket. I thought of my old patient, the young woman with lupus I'd misdiagnosed a decade ago. Her symptoms had been vague: rashes, fatigue, joint pain, until they weren't. By the time I realized it was a lupus flare, her kidneys had failed. Her family's grief still haunted me, their eyes accusing me in my dreams. I couldn't let Reeves become another ghost. Javier found me in the break room at 3 a.m., holding a crumpled piece of paper. "This was in his jacket," he said, his voice low. It was covered in chemical formulas. Tyrosinase, melanin precursors, UV adaptive compounds. Gibberish to me, but it felt like a lifeline. He's a biochemist, Javier added. Or was. I looked him up. Published some wild stuff about melanin augmentation years ago, before he dropped off the grid. Melanin augmentation. The idea was straight out of science fiction. Engineering skin to adapt to radiation, UV light, or extreme environments. Reeves had been a researcher, brilliant but unorthodox, until his lab lost funding. Had he kept experimenting? Was this blackness the result of some rogue trial? I sent the paper to a lab for analysis, but my gut told me we were running out of time. Underscore 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 underscore. By morning, Reeves was worse. His hallucinations were vivid now, his voice slurring as he ranted about the light breaking through. His pain had spiked, and I added gabapentin to his regimen, hoping to calm the nerve fire raging inside him. The blackening had reached his neck, a collar of pigment that made him look like a statue carved from ebony. I touched his arm, expecting warmth, but it was cool, waxy, like something not quite human. I called a team meeting, pulling in Kim, Javier, and 2 residents. The room was tense, the air thick with coffee and fear. Let's brainstorm, I said, writing on the whiteboard. Autoimmune, poison, genetic. The residents threw out ideas. Addison's disease, scleroderma, toxic epidermal necrolysis. But none fit. Kim shook her head. 10 would show skin sloughing. This is internal, not epidermal. Javier stayed quiet, his eyes on the floor. What is it, Javier? I asked. He hesitated. He keeps saying it's happening again. What if this isn't the first time? The room went silent. Again. The word hung like a guillotine. I thought of Reeves' papers, his formulas. Had he done this to himself before? Was this a failed experiment gone wrong? I was spiraling, the exhaustion and guilt blurring into one. My old patient's face flashed in my mind. Her pale skin, her shallow breaths. I'd missed the signs then, and I was missing them now. I looked at Reeves' chart again. The labs mocking me with their normalcy. No infection, no clotting, no toxins. Just a man turning black from the inside out. I had missed something, and it would almost kill him. The hospital felt like a tomb by day 6, the air heavy with fear and the sharp tang of antiseptic. Jonathan Reeves was no longer just a patient. He was a specter, his body a canvas of blackening skin that defied every test, every theory. I'm Dr. Meredith Lynn, and as I watched the shadow consume him, arms, chest, now his face, I felt the ground slipping beneath me, just like it did 10 years ago, when I lost a patient to my own blindness. Reeves was in the ICU now, his condition a runaway train. The blackening had reached his jaw, giving him a ghostly, statuesque look, his features blurred under a glossy obsidian sheen. His hair was falling out in clumps, littering the pillow like ash. His mucous membranes, lips, gums, the insides of his eyelids, had darkened, too, a deep indigo that made my stomach lurch. He was delirious, his voice a slurred chant of the light, as if he were praying to something I couldn't see. His pain was unrelenting, a deep burn that morphine and gabapentin barely touched. I stood by his bed, my hands trembling as I adjusted his IV, and felt the weight of my failure pressing down. I was losing him, and I didn't know why. Nurse Javier, usually my anchor, was unraveling. He's not human anymore, he muttered, his eyes red from lack of sleep. I wanted to snap at him, to tell him to pull it together, but I couldn't. The fear was contagious, spreading through the staff like a virus. One of the ICU nurses quit that morning, grabbing her bag and muttering, "He's cursed." She didn't look back as she left, her footsteps echoing in the empty hall. I wanted to laugh it off, to call it superstition. But the truth was, I was starting to wonder if she was right. Underscore 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 underscore. Dr. Kim, the infectious disease specialist, was stumped. We sat in the conference room, the whiteboard covered in crossed-out theories. Now RSA, necrotizing fasciitis, methemoglobinemia, toxic epidermal necrolysis. This isn't in, Kim said, her voice flat. No epidermal slaving, no blisters. The pigment's internal, not a surface reaction. I nodded, but my mind was elsewhere, replaying Reeves' words. It's happening again. Again. The word was a splinter in my brain, sharp and unyielding. What had he done to himself? What had he done before? I thought of the paper Javier found in Reeves' jacket. Chemical formulas. Tyrosinase, melanin precursors. We'd sent it to a lab, but the results wouldn't be back for days, and Reeves didn't have days. His vitals were slipping. Blood pressure 90/60ths, heart rate 110, oxygen saturation dipping to 94%. His kidneys were struggling, his urine dark and sluggish. I ordered dialysis, hoping to buy time, but it felt like bailing out a sinking ship with a teaspoon. The hospital administrator, Carol, called again, her voice like nails on a chalkboard. "Meredith, we're out of options. No diagnosis, no funding. We need to transfer him to a state facility." I gripped the phone, my knuckles white. "Transfer him where, Carol? No one's seen this before. He's dying. And you want to pass the buck." She started to argue, but I hung up, my hands shaking. I didn't have time for her. I didn't have time for anything. Underscore 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 underscore. Javier came to me that afternoon, holding a napkin he'd found in Reeves' belongings. It was scrawled with a coded message, Project Humelanin. Trial 7. Failure imminent. My heart sank, a cold weight in my chest. Humelanin was the primary pigment in human skin, responsible for dark tones. Trial 7. Failure. This wasn't just a rogue experiment. It was a series, and Reeves had known it would go wrong. I stared at the napkin, the ink smudged from his sweat, and felt a chill. He'd been playing God, and now his body was the battlefield. I tracked down his estranged daughter, Janine, through an old colleague. She arrived that night, a wiry woman in her 30s with her father's sharp eyes and a guarded expression. We sat in the family room, the fluorescent lights buzzing overhead. "He was obsessed," she said, her voice tight. "Said he could make humans stronger. Adapt to anything. Radiation, UV, extreme climates. He tested it on himself after his lab lost funding." She paused, her hands twisting in her lap. "He shut me out years ago. Said I wouldn't understand." I showed her the napkin, and her face paled. "Project Humelanin," she whispered. He talked about it like it was his legacy. Melanin augmentation, something about synthetic tyrosinase and Alex. I nodded, piecing it together. Tyrosinase is the enzyme that drives melanogenesis, the process that produces melanin. A synthetic analog could, in theory, supercharge it, but at what cost? Janine's eyes met mine, and I saw the fear there, the guilt. "He said the trials failed," she added. "The animals. Their immune systems turned on them." Flashback. Reeves' old papers, the ones Javier had found online, described early trials with mice. The animals developed hyperpigmentation, then autoimmune reactions, their bodies attacking their own pigmented tissues. The project was shut down, deemed too dangerous. But Reeves hadn't stopped. He'd gone off-grid, turned his cabin into a lab, and used himself as a guinea pig. The blackening wasn't a disease. It was a consequence. Underscore 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 underscore. I ordered a DNA panel, praying it would confirm my suspicions. In the meantime, Reeves was fading. His delirium had worsened, his words incoherent. Something about the light breaking the cage. His skin was now fully black from the neck down, a glossy, unnatural sheen that made him look like a sculpture. His lips were cracked, his gums bleeding, the indigo pigment seeping into every tissue. I checked his chart. Liver enzymes elevated, creatinine through the roof. His organs were shutting down, overwhelmed by whatever was happening inside him. The staff was on edge, their whispers growing darker. "It's not natural," one tech said, avoiding Reeves' room. Even Javier was quiet, his hands trembling as he changed the IV. I caught him staring at Reeves, his face a mask of unease. What if he did this on purpose? He asked me later, his voice low. What if he wanted this? I didn't have an answer. I didn't have anything. I sat by Reeves' bed that night, the monitors beep a steady rhythm in the dark. His face was half-shadowed, the blackening creeping toward his eyes. I thought of my old patient, the lupus case I'd botched. Her family's grief had broken me, left me scared. I'd sworn never to let it happen again. But here I was, watching another life slip away. I was missing something, and it was going to cost us everything. The IQ was a battlefield, and Jonathan Reeves was losing. His skin, now a glossy black from head to toe, gleamed under the stereo lights, a living monument to a science gone wrong. I'm Dr. Meredith Lynn, and by day 8 at Bitterroot Community Hospital, I was staring into the abyss of my own failures, haunted by the patient I'd lost a decade ago, and the one I was about to lose now. But then the DNA panel came back, and everything changed. Reeves was slipping away, his body a war zone of pigment and pain. His delirium had deepened, his words a fevered jumble of the light, and the cage breaking. His organs were faltering. Liver, kidneys, heart, all buckling under an unseen assault. The blackening had consumed his face, his eyes sunken in pools of indigo, his lips cracked and bleeding. He looked less like a man and more like a shadow, a ghost trapped in flesh. I stood by his bed, my hands steady but my heart racing, and knew we were out of time. Nurse Javier was at my side, his usual calm frayed to threads. "He's not gonna make it, Meredith," he said, his voice low. "Not like this." I wanted to argue, to tell him we'd find a way. But the truth was heavy in my chest. The staff had all but given up, their whispers now openly fearful. "He's not natural," one tech said, avoiding his room. Even Dr. Kim, the infectious disease specialist, was out of ideas, her whiteboard a graveyard of crossed-out theories. Methemoglobinemia, toxic epidermal necrolysis, autoimmune disorders. Nothing fit. Nothing explained the blackening. Underscore 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 underscore. The DNA panel arrived that morning, and it was a bombshell. I sat in the conference room, the report trembling in my hands. Reeves had undergone unregulated gene therapy, likely in his own makeshift lab in the Bitterroot Valley. He'd introduced a synthetic gene to boost melanin production, a reckless bid to supercharge melanogenesis, the process that pigments skin. The gene had worked too well, flooding his tissues with melanin precursors, turning his skin into a canvas of obsidian. But that was only half the story. His immune system, triggered by the synthetic tyrosinase analogs, was now attacking his own pigmented cells, a lupus-like autoimmune collapse that was shredding his organs from the inside. I stared at the report, my coffee cold on the table. Tyrosinase is the enzyme that drives melanin synthesis, converting tyrosine into melanin precursors like dopaquinone. Reeves' synthetic analog had hijacked the process, creating a runaway cascade. The blackening wasn't just cosmetic. It was a death sentence, his body drowning in its own pigment. I thought of the napkin Javier found. Project Eumelanin. Trial 7. Failure imminent. This was Trial 7, and Reeves had known it would fail. Janine, his estranged daughter, was in the family room when I found her. She was a wiry woman, her father's sharp eyes shadowed by grief and anger. I showed her the DNA results, and her face crumpled. He said he could make humans stronger, she whispered, her hands twisting in her lap. Adapt to radiation, UV, anything. He tested it on himself because no one else would. She paused, her voice breaking. He shut me out, said I wouldn't understand. I should have stopped him. I thought of my own ghosts, the lupus patient I'd failed 10 years ago. Her family's grief had carved a hole in me, one I'd never filled. I saw that same guilt in Janine's eyes. The weight of what-ifs. You couldn't have known, I said, but the words felt hollow. I handed her the napkin, the coded message. Project Eumelanin. She read, her voice barely audible. He thought this was his legacy. Underscore 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 underscore. There was a chance to save him, but it was a long shot. An experimental immunosuppressive regimen, high-dose corticosteroids, rituximab, and cyclophosphamide, could dampen the autoimmune attack. Paired with chemical chelation to bind the excess melanin precursors, it might stabilize his organs. But the risks were brutal. 80% chance of permanent organ damage, blindness, or neurological impairment. Even if he survived, he'd never be the same. I sat with the treatment plan, the pages heavy in my hands, and felt the weight of the decision. This wasn't just medicine. It was a gamble with a man's life. I brought the plan to Kim and Javier, the conference room thick with tension. Kim frowned, adjusting her glasses. This is uncharted territory, Meredith. The immunosuppression could tank his system completely, and chelation for melanin precursors. There's no protocol for that. Javier was quieter, his eyes on the floor. What's the alternative? He asked. Let him die. No one answered. The silence was answer enough. Janine sat by her father's bed, holding his hand, her face a mask of resolve. Do it, she said when I explained the risks. He'd want to fight, even if it breaks him. I saw the love in her eyes, buried under years of estrangement, and it hit me hard. I thought of my own failures, the patients I couldn't save, the promises I'd broken. This time, I had to try. Underscore 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 underscore. We started the treatment that night, the IV lines dripping with drugs that could either save Reeves or destroy him. I watched the monitors, the numbers flickering like a storm warning. heart rate 120, blood pressure 85/55, oxygen saturation 92%. His fever spiked to 102.4 degrees Fahrenheit, his body trembling under the blanket. The blackening hadn't slowed, his skin a glossy void that seemed to swallow the light. I stood by his bed, my hands clenched, and prayed I hadn't made the wrong call. Javier stayed with me, his presence a quiet anchor. "You're doing everything you can," he said, but I shook my head. "Everything's not enough if he dies." I thought of my old patient, her pale face in the morgue, her family's sobs echoing in my ears. I'd missed the signs then, and I was terrified I was missing them now. The DNA panel had given us a path, but it was a tightrope, and Reeves was slipping. The hospital was a ghost town at midnight, the halls silent except for the hum of machines. I sat by Reeves, his breathing ragged, his face a mask of shadow. Janine had fallen asleep in the chair, her hand still clutching his. I looked at them, father and daughter, and felt a pang of something I couldn't name. Grief, maybe, or hope. Reeves had dared to rewrite the human body, and now it was breaking under his ambition. I had dared to save him, and I wasn't sure I could. I was missing something, and it might cost him everything. The IQ was a crucible, and Jonathan Reeves was burning. His body, a blackened shell of rogue pigment, lay under the sterile lights of Bitterroot Community Hospital, teetering on the edge of survival. I'm Dr. Meredith Lynn, and by day 11, I'd staked everything, my skill, my sanity, my ghosts, on saving a man who dared to rewrite his own biology. But the cost of that dare, and my own, was more than I'd ever imagined. We'd started the experimental treatment, high-dose corticosteroids, rituximab, cyclophosphamide, and chemical chelation, knowing the odds were brutal. 80% chance of permanent organ damage, blindness, or neurological impairment. Reeves' skin, a glossy obsidian from head to toe, was peeling now, layers sloughing off like a snake shedding a cursed hide. His vitals were a roller coaster, heart rate spiking to 130, then dropping to 60, blood pressure crashing to 80/50, then stabilizing. I stood by his bed, my eyes locked on the monitors, and felt the weight of every decision I'd made. I'd saved him from the blackening, but at what price? Nurse Javier was there, his hand steady as he adjusted the IV. "He's fighting," he said, but his voice was hollow. The staff had stopped whispering about curses, but the fear lingered, a shadow in their eyes. Dr. Kim, the infectious disease specialist, had left for Seattle, her parting words a grim warning. "You're in uncharted waters, Meredith. Good luck." I didn't need luck. I needed a miracle. Underscore 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 underscore. The next 72 hours were a blur of alarms and adrenaline. Reeves' fever broke on day 9, dropping to 99.1 degrees Fahrenheit, but his kidneys were failing, his creatinine levels soaring. We pushed dialysis, the machine humming like a grim metronome. His skin continued to peel, revealing raw pink tissue beneath, mottled with patches of fading pigment. It was a grotesque rebirth, his body shedding the blackening like a nightmare it couldn't hold. But the damage was done. His retinas, scared by the autoimmune attack, were beyond repair. His vision was gone, his world reduced to darkness. His speech was slurred, his hands trembling with neurological misfires. He was alive, but he was broken. Janine, his estranged daughter, stayed by his side, her wiry frame curled in a chair. She read to him from old biochemistry journals, her voice soft but steady. He wanted to make humans stronger, she told me one night, her eyes red from crying. He made himself into a warning. I saw the forgiveness in her gaze, the kind that comes from years of pain and love intertwined. It hit me hard, stirring memories of my own failures. The lupus patient I'd lost a decade ago, her family's grief a scar I still carried. Janine had found a way to let go. I wasn't sure I ever would. I sat in my office that night, the hospital quiet except for the distant beep of monitors. Reeves' chart lay open, a chronicle of my desperation. Normal labs, failed theories, the DNA panel that finally cracked the case. He'd engineered a synthetic gene to boost melanogenesis, flooding his tissues with melanin precursors via a rogue tyrosinase analog. His immune system, triggered by the experiment, had turned on him, attacking pigmented cells in a lupus-like collapse. We'd stopped the cascade, but the cost was staggering. I thought of the ethics of it all. Unregulated gene therapy, a biochemist playing God in a Montana cabin. Reeves had crossed a line, and his body had paid the price. Underscore 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 underscore. The hospital administrator, Carol, called the next morning, her tone softer but still clipped. "You saved him, Meredith. That's something." I didn't respond. Saved him. I'd kept him breathing, but I'd also sentenced him to a half-life. Blind, trembling, tethered to machines. Carol didn't push, for once, and I was grateful. The hospital was still on fumes, but Reeves' case had drawn attention. A research team from Seattle wanted to study him, to learn from his unique presentation. I refused. He wasn't a specimen. He was a man. Javier found me in the break room later, holding a coffee he didn't drink. "You did what you could," he said, his eyes searching mine. "More than most would." I shook my head, the guilt heavy in my chest. I should have seen it sooner, the formulas, the clues. I almost lost him. Javier didn't argue, just sat with me in the silence. He'd seen me at my worst 10 years ago, when the lupus patient died. He knew the ghosts I carried. Nurse Javier was there, his hand steady as he adjusted the IV. "He's fighting," he said, but his voice was hollow. The staff had stopped whispering about curses, but the fear lingered, a shadow in their eyes. Dr. Kim, the infectious disease specialist, had left for Seattle, her parting words a grim warning. "You're in uncharted waters, Meredith. Good luck." I didn't need luck. I needed a miracle. Underscore 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 underscore. The next 72 hours were a blur of alarms and adrenaline. Reeves' fever broke on day 9, dropping to 99.1 degrees Fahrenheit, but his kidneys were failing, his creatinine levels soaring. We pushed dialysis, the machine humming like a grim metronome. His skin continued to peel, revealing raw pink tissue beneath, mottled with patches of fading pigment. It was a grotesque rebirth, his body shedding the blackening like a nightmare it couldn't hold. But the damage was done. His retinas, scared by the autoimmune attack, were beyond repair. His vision was gone, his world reduced to darkness. His speech was slurred, his hands trembling with neurological misfires. He was alive, but he was broken. Janine, his estranged daughter, stayed by his side, her wiry frame curled in a chair. She read to him from old biochemistry journals, her voice soft but steady. He wanted to make humans stronger, she told me one night, her eyes red from crying. He made himself into a warning. I saw the forgiveness in her gaze, the kind that comes from years of pain and love intertwined. It hit me hard, stirring memories of my own failures. The lupus patient I'd lost a decade ago. Her family's grief a scar I still carried. Janine had found a way to let go. I wasn't sure I ever would. I sat in my office that night, the hospital quiet except for the distant beep of monitors. Reeves' chart lay open, a chronicle of my desperation. Normal labs, failed theories, the DNA panel that finally cracked the case. He'd engineered a synthetic gene to boost melanogenesis, flooding his tissues with melanin precursors via a rogue tyrosinase analog. His immune system, triggered by the experiment, had turned on him, attacking pigmented cells in a lupus-like collapse. We'd stopped the cascade, but the cost was staggering. I thought of the ethics of it all. Unregulated gene therapy, a biochemist playing God in a Montana cabin. Reeves had crossed a line, and his body had paid the price. The hospital administrator, Carol, called the next morning, her tone softer but still clipped. "You saved him, Meredith. That's something." I didn't respond. Saved him. I'd kept him breathing, but I'd also sentenced him to a half-life. Blind, trembling, tethered to machines. Carol didn't push, for once, and I was grateful. The hospital was still on fumes, but Reeves' case had drawn attention. A research team from Seattle wanted to study him, to learn from his unique presentation. I refused. He wasn't a specimen. He was a man. Javier found me in the break room later, holding a coffee he didn't drink. "You did what you could," he said, his eyes searching mine. "More than most would." I shook my head, the guilt heavy in my chest. I should have seen it sooner, the formulas, the clues. I almost lost him. Javier didn't argue, just sat with me in the silence. He'd seen me at my worst, 10 years ago, when the lupus patient died. He knew the ghosts I carried. Reeves woke on day 12, his voice a rasp. "Janine." He called, his blind eyes staring at nothing. She took his hand, her voice breaking. "I'm here, Dad." He smiled, a small, broken thing, and I felt a pang in my chest. He'd dared to change the world, to make humans stronger, and he'd lost everything. His sight, his strength, his freedom. But he had his daughter, and maybe that was enough. I stood outside his room that evening, watching through the glass as Janine read to him. The blackening was gone, his skin a patchwork of raw pink and fading gray, but the scars, physical and otherwise, would never fade. I thought of my old patient, her pale face in the morgue, her family's sobs echoing in my dreams. I'd blamed myself for years, but maybe the truth was simpler. Medicine is a battle against limits, against the human urge to dare too much. Reeves had dared, and his body had broken. I'd dared, and I'd saved him, but at a cost that haunted me. We look for patterns, for causes, for someone to blame. But sometimes the body breaks because we dare too much. Reeves had wanted to rewrite humanity, to shield it from a hostile world. Instead, he'd written a warning in his own flesh. I'd wanted to redeem my past, to prove I wasn't the doctor who failed. But redemption isn't clean. It's messy, painful, and never complete. I walked away from the ICU, the hospital's hum fading behind me. The Montana sky was clear, stars sharp against the dark. I thought of Reeves, blind but alive, and Janine, forgiving but scarred. I thought of my own ghosts, quieter now but never gone. Medicine isn't about winning. It's about fighting, even when the cost is everything. I had saved him, but I had missed something, and it would stay with me forever.